I tested positive to the hepatitis B virus, and what is the next step? After you've been diagnosed with hepatitis B, the next thing that we need to know is to know the extent of the infection, and that can only be determined when you have done the various laboratory investigations. There are some basic labs that will help the doctor to know what actually might be happening. You must understand that not everybody who tests positive to the hepatitis B virus would have to be given antiviral drugs. Currently, there hasn't been any documented cure for chronic hepatitis B, but when it is acute, it's likely to go. There is a 99% likelihood that acute infections will probably go away without you having any symptoms or without you having to know. And you can also live with the Hep B virus for several years without manifesting any signs and symptoms. And these signs and symptoms might manifest when the liver has been significantly impacted by the virus. So after your diagnosis, first of all, you need to seek medical care. And your doctor would ask you to do certain labs, hepatitis B profile, which will allow us to know whether the virus is active or inactive, a liver function test, which will help us to know how the liver is functioning. We can do a viral load, and the viral load would quantify the amount of the virus. Sometimes your doctor may even ask you to do an abdominal scan to know if the liver has been enlarged. All these results put together and the physical assessment that the doctor will conduct on you will tell if you would need treatment or not. Just know that only about 30% of the people living with chronic hepatitis B would have to be put on treatment. And for the rest of us who have inactive infection, we have to be constantly monitored because the liver can be damaged and still be functioning very well. You can follow me for more.